Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and today we're going to talk about laser resurfacing and kind of the procedure and especially the post-op instructions. Cosmetic facial surgery is my passion, and I love doing all types of surgery, but one of the favorite things that I've had over the years has been laser treatment. And aggressive full-face CO2 laser resurfacing is still the gold standard for improvement of wrinkles, skin tightening, and brown spots. And although there's a lot of trendy miracle lasers that you see out there that heal in 3 or 4 days, they really just don't do much. And I've done over 1,000 cases of what I call old school CO2 laser resurfacing. And you know, just because something is new doesn't mean it's better. So this has turned out to be a great treatment that is truly effective for removing decades of aging and sun damage from the skin. And I've had it done myself. I've had my face lasered several years ago. Now, this is really a valuable procedure with big results, but it also is a formidable recovery. And it's a situation that is just, to find a better word, is sort of yucky, okay? There's a lot of swelling. Your face is covered with greasy, dead skin, and that first week is just kind of tough. The second week is a lot better, and usually by anywhere from day 9 to day 12, patients have their primary healing completed and they're back in makeup. You know, what I do as a surgeon has a lot to do with the result, but with laser treatment, what the patient does also has a lot to do with the result. So not taking care of your lasered skin properly can affect the result. In patients that are very compliant and do things as they're supposed to, simply have a better result. So let's talk about a couple things. Number one, you know, you're going to be sedated, and we're going to make a controlled burn on your skin with the laser. And there are various depths that we go, and you know, most of these will heal anywhere from a week to 2 weeks, and most of the lasers that we do are aggressive, and they take almost 2 weeks for the initial healing. So when you wake up, your face is going to feel warm like a sunburn, and again, I've been through this, and you're going to have a coat of some type of what we're going to call grease on your face, and that could be Vaseline, Aquaphor, or some of the other products that we'll discuss. And basically, for the first night, you're going to put cold compresses. So I just take a salad bowl that's clean, fill it with ice cubes and water, put about 5 washcloths in there, wring it out, put it on your face, and the cold compresses are soothing. So it helps the discomfort and it helps the swelling. So when you put the compresses on, the grease substance is going to come off. So the only thing you really need to do for that first night is to put on the cold compresses and apply the ointment, which is a better word than grease, continuously. So that's what you do for the first 24 hours. Again, like anything we do in life, you're going to have the best results if you're prepared. I've spent a lot of time making this laser guide, and it has complete instructions about how to take care of your lasered skin and your medicines and which potions and lotions to use, and even the little complications and minor things that we see commonly with laser resurfacing. So my first word of advice is to plan ahead. All right, you're going to be taking 4 or 5 medicines. You're going to be using 4 or 5 different lotions or creams, and you don't want to go through this when you get home and you are post-operative and you're still sedated and you're taking pain medicine. You want this to be all set up before you get there. It's so important that your caregiver understand what medicines to take and how to take care of your lasered skin. And again, this takes some planning. So everybody will get this guide, and this is on our web page under the post-op laser treatment, and you can download this or look at it. But basically, we have a little table that tells you what medicines you're going to take, what they're for, and how you take them. Because you're going to be on an antiviral medicine, an antibiotic, a pain medicine, possibly an anti-swelling medicine. So you have numerous medicines, and then you have these various creams and lotions that you're going to be using. And really, again, when you're recovering, you don't want to be trying to figure out things. So I like people to take a magic marker and put number 1 on the cream that they use first, number 2 on the cream that they use second, and just get your ducks in a row. All right, now we're going to talk about the real meat and potatoes of your laser recovery, and this is the ointments and lotions that you're going to apply. Now there's a myriad of different things that you can put on your face, and we really try and simplify this, and we've gone to the Vanaply or Vanacream. It's a company that makes products with no preservatives, no perfumes, and it's great for people that have any allergies. And what's great about this is you can put it on raw skin. So it's a great product, and you can get it at Walgreens or from our office, and it's easy to get. So you want to get this stuff in advance. Now, this is what we're going to call the grease or the ointment, okay? And this is called Vanaply ointment. You could also use Aquaphor. You could also use Vaseline. We would prefer to stick with this brand because we know that it is safe from preservatives, perfumes, and things like that. So this is our grease. When you wake up, you're going to have this on your face, and like I said earlier, all you're going to do on day 1 is put cold compresses on and keep the Vanaply ointment. You just need a thin coat. You don't want to put too much on the forehead or the eyelids because it gets in your eyes and it makes your vision blurry. It won't hurt you, but you don't need to put an inch of it on. You just need to keep the skin coated, and this has to be greasy 24/7. So you just want to keep your face greasy for that first week. All right. So this is your big thing here, your Vanaply ointment. Now you're going to start washing your face on the next day after your surgery, after your laser. And this is a Vanacream cleansing bar, but they also make a cleanser in a pump, and that's probably what we recommend. I think it's a little easier to use the gentle cleansing lotion, and it's made by Vanaply. I happen to have the Vanacream cleansing bar here. So you either use the cleansing bar or, more popularly, the Vanacream gentle cleanser in the pump. And what you're going to do is wash your face with tap water or in the shower. You're not going to use a washcloth, and you're just going to gently wash your entire lasered area, whether it's just your eyes or your whole face, with the gentle cleanser. And we like to do this twice a day. When I had my laser, I preferred to do it in the morning when I woke up. I did it in the shower, and then I took a shower before I went to bed. I let that water soak on my face, and I gently washed it. So whether you do it in the shower or over the sink, what you're going to do is start washing your face twice a day. So for the first 8 days, 9 days, something like that, all you're really going to need to do is to apply the Vanaply ointment or the Vanacream gentle cleanser, all right? And you'll wash your face twice a day. Now, if for some reason you don't have this, for the ointment you could use Vaseline or Aquaphor, and for the cleanser you could use Cetaphil gentle cleanser, which is available to drugstore, or you can even use baby shampoo. But again, we like to keep everything the same and use these Vanaply and Vanacream products. So every day you're going to keep the ointment on your face, and you're going to wash your face twice a day. This is the end of Post-Laser Instructions Part 1. Please view Part 2 to complete your knowledge.